Contact lenses can be very tricky, especially if you're a first-time wearer. Here's a few pointers to get the contact lenses in and out. First step is always wash your hands. Always bacteria can get underneath your fingertips. You want to make sure your hands are nice and clean. So now you're going to retrieve the contact lens out of the well. And that can actually be a little difficult because it's so hydrated, it's hard to maneuver the contact lens on your fingertips. Just do one fingertip at a time. Don't use two hands. You're going to rip it or potentially cause a stress crack in it. Now you have the contact lens on your fingertip. When you look at the contact lens, it should almost form like a bowl. If it's inside out, you'll see the edges kind of flare out, and that won't go on the eye and it'll actually feel a little uncomfortable. So now we're at the point we're going to insert it in the eye. Now there's no really right or wrong way of putting in a contact. Just do whatever works best for you. Your contact lens is approximately 14 millimeters. Your eye, your fissure is not that wide. So it's a good practice to learn to pull back both your upper and lower lids to make a bigger opening for the contact. For many patients, this is pretty difficult. Playing with our eyes is just not a natural thing. Another method is to look away and place the contact on the white part of the eye. And then look across, the contact lens will just drape over the cornea. Now it's time to remove your contact lenses. Just like insertion, you definitely want to wash your hands before you do this as well. We need to open up the eye as wide as we can, look up a little bit, and you can just kind of pinch off the contact lens. And I say pinch, you don't want to actually squeeze it, just gently pull the contact lens off. Another way of removing it, and this actually may be a better way depending on the length of your fingernails, is to drag the contact lens more towards the white part of the eye. The curvature is a little bit different. It'll kind of bunch up and it becomes easier to pull off the eye. As with anything, the more practice, the easier it becomes. Don't get frustrated with it. Keep at it. You'll be a pro at this in no time.